Hello, my name is Tamika King, and I'm in favor of the plaintiff in case number 4, Patients versus AU Bright Smiles Dental Clinic. An OCR investigation confirmed that AU Bright Smiles Dental Clinic flags the records of patients with AIDS with a red label clearly marked AIDS. Patient records can be seen by staff members. According to HIPAA regulations, this information should only be disclosed to staff with the need to know. This label clearly notifies everyone in the clinic of a patient's medical status. The creation of HIPAA resulted in national standards for the protection of personal health information through what is known as the Privacy Act. Virtually every entity that is involved with healthcare is affected by HIPAA. There are severe civil penalties for noncompliance with HIPAA regulations or for knowingly violating patient privacy. The underlying purpose of the privacy rule is to ensure the confidentiality of patients' medical information. A key to this is to remove patient identifiable information from the outside of medical and dental records. Although the label doesn't directly identify the patient by including a name, the record itself will have the patient's name along with other patient identifiers such as social security numbers. Being able to link the two together would clearly identify which patients were battling HIV or AIDS. This in itself creates a potentially dangerous environment because this would deter patients from accurately disclosing their medical history, which could jeopardize their treatment. For instance, them withholding their treatment medications could lead to dangerous drug interactions, which might result in other malpractice lawsuits. This record labeling process that you have in place could lead to grave danger to not only the patients, but to your staff as well. The defendant mentioned that the dental records are labeled with red labels to protect the staff. She mentioned they need to make sure that they have the proper equipment to treat the patient. Unless I'm misunderstanding the situation at hand, all patients are to be treated with the same equipment and staff are to wear the same personal protective gear for all patients. Healthcare workers are trained to practice universal precautions. Universal precautions is an approach to infection control to treat all human blood and certain human body fluids as if they are known to be infectious for HIV, hepatitis B, or other blood-borne pathogens. United States Department of Labor Blood-Borne Pathogen Standard 29 CFR 1910.1030 clearly defines what measures to take to protect both the patients and healthcare workers from contacting blood or other potentially infectious diseases. The protection of the privacy of patients' medical information is important to all patients, but mostly important to patients with HIV and AIDS. Most HIV and AIDS patients do not want to share information of their medical status amongst other sensitive topics because the release of this information may lead to stigmatization. There are many places where HIV and AIDS stigma still exists, especially in healthcare facilities, even where communities and healthcare providers feel that the stigma is limited. This stigma not only affects the patients living with HIV and AIDS, it affects other patients as well. This breach of information could possibly make other patients concerned about their own patient information confidentiality. These red labels are clearly a violation of a patient's right to privacy and should be removed from the outside of the dental